Hey guys, my name is Scott Peasley and I'm a level 1 pain physiotherapist as part of the APA. And basically what we're going to go over today is routine that can help with the biopsychosocial model of health. So we've talked in previous videos about the biopsychosocial model. So this basically entails the physical, the psychological, and the social components of health. That being physical, so that could be movement related, it could be any, disease processes or pathologies that are happening within the body. There's also the psychological component of it, so basically our emotions and how we feel about, particular injuries or illnesses. And then also the social component, which has got to really do with basically cultural influence, how the environment interacts with us when it comes to our injury or illness. So again, I'm speaking straight from just a video, as if I'm not doing any sort of editing or anything like that, because I think it's important for particularly just me to develop as a practitioner the use of communication, and also so it gives you a bit more of an authentic experience into healthcare and what, especially blokes, what they can expect. So there's a big question that I've been posed with a lot of my clients recently, and it's starting to really become apparent to me about how important the psychosocial factors are when it comes to health and even physical health and injury management. And, it's something that's not addressed enough. It's not talked about enough, especially with blokes. So I think that the best thing to do is really address that. And then what I really want to get at is talk about routine. I'm going to use some experiences I've had this week to kind of show an example of, why this is so powerful and how it does affect physical health. Obviously, I'm not going to use any names or anything like that, but I'll be able to draw on my experiences just so, as I said, it gives you a more authentic version of reality, really. So, let's get started. A lot of the patients that I see these days, they've been in pain for a long period of time. And we've talked about chronic pain and the factors of chronic pain in our last video about how we can address and see those factors through the questionnaires, especially a lot of the psychosocial stuff. So what I mean by psychosocial is the environment and how we feel about our injury. And this stuff's starting to really become apparent to me about how much it actually affects someone. So if you did do those questionnaires to start off with, and then you see some high results come from those, maybe a lot of fear of movement, about your perception of your disability, or your level of disability, I should say, and also maybe you're blaming someone else for what happened with the injury. Maybe you've got what we call perceived injustice. Perhaps maybe you've got a lot of low confidence when it comes to movement, or maybe it's even just the whole process has, caused a bit of some depression, some anxiety, some stress. So, all those factors actually feed into pain as well too. I think it's one of those things where if we're not, if we're in those depressed moods, those anxious moods, those very stressful moods, it makes it very, very hard to concentrate on the things that are going to give us at least an advantage to having good health. And if we can't get those things right, I feel like they are kind of the flaw of, foundation, or I guess you would say just the foundation, because, I mean, at the end of the day, if you don't have a good foundation, then a lot of the physical stuff that us, especially what I would call us as physiotherapists, try to help treat people with, we don't exactly get great outcomes just because we're not addressing, the underlying or the external factors that can cause a lot of disadvantages to recovery. So, I guess I like using the analogy. No reputable builder would ever try and, build a sky rise on sand. Okay. Eventually it's all going to break down. So, without addressing some of the underlying psychosocial factors, it's kind of a recipe for disaster, and it's usually the kind of people that you'll see in 6 months again. So, that's something that I really want to address today, and something that realistically what we can offer as physiotherapists as well, but then also offer in the sense of just the basics. Because I feel like I see a lot of, especially blokes too, I see a lot of blokes that I'll just give them what I would consider very basic health advice, and they love it. And it's so simplistic sort of stuff, but life does get tough as well. So I think it's, something that we'll consider. So what I've actually started doing recently is helping people with daily routines. So not just part of their day. Maybe if they're really struggling, we'll sort out parts of their day first. But now what I'm actually doing is sorting out full days for people and what they can expect. So I was talking to a doctor of psychology, Dr. Mike Shelley, probably about 5-6 months ago. And we were talking about consistency. And psychologically speaking, he told me that consistency is deemed pretty much about if you can do something 5 days a week. So it doesn't need to be every single day for the rest of your life. Okay, don't be the tyrant of your own life. Don't make yourself don't force yourself to do it when you potentially could reach some pushback, even just from your own emotions. Okay, it's all right to talk about emotions too, guys. I know it is 2020 and there's more experience out there about emotions, but it's okay to actually talk about them to any health practitioner. And if they're not listening to you, okay, and you don't feel like they're listening to you, that's okay. It doesn't mean they're not a great health practitioner. It means that maybe that you just don't gel with that person, and that's okay too. It's all right to find someone else. But anyways, so consistency is considered 5 days a week. So what I've started doing is actually helping people organize their day when perhaps maybe they're not at work or they don't have a lot of stuff going on at the moment. So maybe some meaningful stuff going on at the moment. Because if we can get some of the little things right, then that leaves a window for meaningful things to actually happen. So one of my clients, who obviously I won't say their name of, I started not getting I felt like I wasn't getting to the place I needed to be when it came to their physical health and their recovery. So, I broke it down, I gave it some thought, and I started talking about routine. And to be honest, I feel a little bit silly that I didn't address this earlier, but I addressed it, a little bit later on down the track, and I said to him, okay, so tell me about your daily routine. How does that go for you? And the first, I guess, yellow flag that popped up for me was, are we talking about when it starts the night before, or? I went, oh my God, no. Yep. Okay, so what time do you go to bed the night before? It ranges from 5 o'clock in the afternoon till 1 o'clock in the morning. That's when between the times I fall asleep. So I said, wow, okay, so when do you wake up? Anywhere from 9 o'clock till, sorry about that, low battery. Anywhere from 9 o'clock till, he said, probably 1 o'clock in the afternoon. And I was like, oh my God, like, you know, you're not even getting any, then like, is it quality sleep? And he said, no, like, I'm waking up every hour. I'm like, well, so we got to work on routine straight away. So I said to him, so is there any chance that you're able to get to bed at 9 o'clock or 9:30? He sort of said to me, yeah, like, I could try at least. I'm like, okay. So if you get to bed at 9 o'clock or 9:30, what do you reckon's a reasonable time to wake up? And he sort of said, oh, maybe I get up at like maybe 10 o'clock then. I'm like, no, how about you get up at 7? 7 to 7:30 is your window for getting up. And then what are you going to do? What do you usually do? And he says, I usually get up and then go sit on my phone and I'll play that for about 5-6 hours. So we had to literally reschedule his whole day and make sure that he was actually doing something meaningful. Because when we're doing something meaningful, at least something to, you know, support, you know, loved ones, friends, family, you name it, then there's a sense of actually doing that within a community setting. And it's not talked about enough. That if you can actually do something that's meaningful to actually help someone else, or even just help yourself, okay? If you feel like you're in a bit of a low mood, okay, or you've got low mood disorder or something like that, tell you what, go look at your room, go clean your room up. I know when my life is in chaos and I feel like I'm doing a million things at once, you go look at my room reflects my life a lot. Clothes are everywhere, my bed's not made, okay? Sometimes what I'll give to people for their weekly task is to keep their room clean. Put in those fundamental movement skills that I'm trying to teach them and use it to clean their room. Works quite well. So if you're ever struggling with any sort of, maybe you're not getting better from some of the, you know, the activities or the exercises that your physio is giving you, go through those questionnaires and then, you know, give yourself a little bit of time just to find little bits or little areas where you can make your life a little bit better. Go into a room, go into any room in your house and ask yourself how you can make this better. You'll start doing this in your real life. Okay? You'll start seeing opportunity. You'll start going for it a little bit more. Okay? Try that. Try scheduling your day. Try writing it down the day before. Give yourself every opportunity to actually succeed. Helps with the psychosocial factors, I can tell you that much. All right. I think that'll do us for today. We've gone a couple of minutes over, but I get quite passionate about this kind of stuff. So at the end of the day, we'll talk about a little bit more about potentially sleep hygiene in the next video, but we'll, I usually come up with my little rants next time. We're about to get potentially a friend of mine who's actually finished his medical degree, and we're thinking about even getting him to come on so we can get like some real experience from a doctor and what he would like to, if he had the optimal patient, what they would be doing, what questions they would be asking him in order for him to deliver the best healthcare. But anyways, glad we could have a little bit of a chat and upload a new video, but we'll cover some more topics soon, potentially on the psychosocial factors of health. Okay, thanks for that, guys. Bye.